Good afternoon and welcome. My name is Carrie Isaac, and I'm the Executive Director of the Sexual Assault Services of Saskatchewan. While SAS is located on Treaty 4 territory, we aim to serve all the territories and treaties that make up Saskatchewan. We are settlers and guests on this land, and we seek to work in collaboration with Métis and First Nation communities in addressing sexual violence in Saskatchewan. We truly believe that we cannot have real systemic change that is not centered in decolonizing principles and reconciliation. Sexual Assault Services of Saskatchewan is a provincial nonprofit organization that works collectively with frontline agencies, community partners, and governments that provide support and advocacy for those affected by sexual violence. The purpose of Sexual Violence Awareness Week is to raise public awareness on issues related to sexual violence in Saskatchewan through educational events, resources, and change-making conversations. Every year, SAS launches a provincial awareness campaign through collaborative efforts with our member agencies, provincial and national partners. The campaign changes from year to year to shine a light on various forms of violence that exist within the continuum of sexual violence. This year's campaign focuses on the issue of human trafficking and sexual exploitation. Human trafficking and sexual exploitation are not new issues that impact individuals within our province. However, there is a significant gap when it comes to understanding, addressing, and responding to the issue. All week, we will be sharing the overarching message that people are sexually exploited and trafficked by their intimate partners every day. We hope that you stay with us throughout the week and all of our events. You can register for our free events at www.sbaw2022.ca. Thank you. Now I'll pass it over to Harmony. She will introduce our next speaker. Thank you.
Thanks, Carrie. So thank you all for being with us today. I'm pleased to introduce our next speaker, Natayla Mason from Saskatoon Sexual Health. Natalia is a sexual health educator and social worker who was born and raised in Saskatoon, Saskatchewan. She is a Black first-generation Canadian and a settler on Treaty 6 territory. She holds a bachelor's degree in psychology from the U of S, a bachelor's degree in social work from the U of R, and a master's degree in women's, gender, and sexuality studies. She is a lifelong member of the Girl Guides of Canada and is dedicated to social justice and reproductive rights for women and girls. Take it away, Natalia.
Hi, everyone. Thanks for having me. I'm just absolutely thrilled to be with you today and having this conversation. I'm going to get my slides up on screen so you have something to look at besides my face. Okay. Okay. Well, we're fine to start from this slide. Thanks for that introduction. My name is Natalia. I work at Saskatoon Sexual Health. I'm the Education and Outreach Coordinator. And in my bio, I included that I am a settler here on Treaty 6 territory because that's a reminder for me to acknowledge the land that I am working on and living on. We're going to be talking about sexuality. Our processes of learning about sexuality have been heavily influenced by colonization, and in some ways for different groups of people who are marginalized, that process has been very violent. And so doing this work is one way that I try to address those historic injustices in my community, and I hope that this will be helpful for you to be able to do that work as well. So just a bit of an overview of what we're going to talk about today. I'll introduce the research that I conducted as part of my thesis for my MA. I'm going to do the research overview, just talk a little bit about the process and how I ended up there. Then I'm going to spend some time talking about emotional intelligence as a theory and in practice. We'll talk about some practical applications for some of the information that I'm sharing, because that's something that's just really critical to me in doing this work, is that we have ways of actually utilizing it. At the end, there is also a scenario, and then there will be time for questions as well. I'm going to do my best to keep an eye on the chat and on the Q&A. So if people have questions as we move through the session, I'm happy to answer those kind of as they come up as well. And I'm sure the SAS staff will help keep me on my toes. So like I mentioned, I work at Saskatoon Sexual Health. I've actually been the education and outreach coordinator here for nearly 8 years, which means I spend a ton of time in classrooms talking to young people about their sexuality. I've presented to more than 10,000 students. I've been telling the kids lately that I've answered more than 5,000 questions about sex. And so that work has been really rewarding, and it's also provided me a lot of opportunity to reflect on the ways that young people are socialized into the world and into their sexuality. And my hopes have always been to be able to unpack some of that socialization so that we can improve the health outcomes for adolescents in this province, but just, nationally and globally as well. So one of the things that I always talk about, oh, are we looking at the wrong set of slides? 1 second here. Let me switch you. Is that better? Patience?
Perfect.
Schwupps. So one of the things that has always come up in doing this work is that, and you're going to see that this research is, for the most part, was about barriers to condom use. So my initial question that I kind of started with at the beginning of identifying my research project was, why don't young people use condoms? And I've been in, like I mentioned, hundreds of classrooms, and I've spoken to thousands of students. And if you talk to young people, they know that they're supposed to use condoms, but there are a lot of social and emotional barriers that interfere with their ability to be able to navigate safer sex practices. And so I wanted to be able to spend some time unpacking that and figuring out what those barriers were so that we could help to develop strategies to help them advocate for the things that they need in relationships. And so even though this research was initially about condom use, you'll see as I kind of move through it that the impacts and the implications go beyond condom use, and talk about things like gender and sexual violence and all of that as well. So I knew for the young people that I worked with that some of the barriers included things like a lack of education, being influenced by gender stereotypes, and also being influenced by power dynamics. So I wanted to be able to unpack those things a little bit more. So the objectives of my research were to develop insights into the implementation of emotional intelligence and comprehensive sexuality education. And that idea actually came from someone that I was really fortunate to learn from, whose name is BK Chan. And BK does lots of work around emotional intelligence, and I had seen them present at a number of different conferences. And so I was interested in the ways that emotional intelligence could be mobilized in terms of sexuality education and helping young people to advocate for their needs and that kind of thing. So just quite generally, the practical implications of using emotional intelligence in this context. I was also hoping to advance best practices in sexual health education. Having been in the role for 8 years, I've had the opportunity really to see a lot of the shortcomings of comprehensive sexuality education, or a lack of comprehensive sexuality education in Saskatchewan and in classrooms in my community. So I was hoping to contribute to moving these conversations forward, wanting to contribute to an existing body of knowledge. And then the last piece there is just that constant striving for relevant, intentional, and holistic and effective comprehensive sexuality education. So of course, one of the first pieces in doing any kind of academic graduate work is going to be conducting a literature review. Throughout on these title slides, I've also included quotes from some of the participants that I worked with doing my research. And this one is one of my favorites. It just says, "What's an encyclopedia?" Because I was talking to the participants about the ways that I learned about sexuality as a young person. And I said, if we wanted to know something about sex, we had to like go to the library and find the S book in the encyclopedia to look it up. And one of the kids said, "What's an encyclopedia?" And I was like, you have got to be kidding me. But that also kind of highlighted the way that access to information has really changed over the last couple of years. And that's couple decades. And that's certainly a theme of the work going forward as well. So to frame my work and my thesis, but also to just like frame my professional work and my personal beliefs, I was working within a theoretical framework as well. And these were some of the theories that were really critical to this work. And from looking at it from the outset now, I think that this stuff is so important in being able to actually live up to some of the values and things that I believe in, and in being able to practice these ideas as well. So one of the pieces of theory that I used was feminist standpoint theory, which is the idea that any theorizing on women's experiences must be practiced from their respective standpoints, respecting their specific social locations. And I'll speak to this more in a bit as well, but this research was obviously focused on adolescent girls specifically because I was trying to get at an experience of gender and marginalization because of gender. But realistically, as we move towards the end of the presentation, you'll see that there are applications for this work regardless of how a young person might identify. But that's why this is specifically focused on women and girls and their experiences. I also used theory as a liberatory practice, which is a perspective which conceives of theorizing as a process of personal, political, and social liberation. This one is really, really critical to me. Theory as a liberatory practice comes out of work from American author and academic Bell Hooks. Her work has just been really foundational for me in my understanding of the world and my place within it. Especially as a woman, as a Black woman, as a queer woman. And so I think that this is important to me because I see myself as a person who is, sidelined, marginalized, and oppressed by a lot of our social values and the ways that we've been socialized. And so for me as well, this is a process of liberation and freeing myself from some of those pressures. There's a whole piece on theory as a liberatory practice. It's an entire article. It's really fantastic. I would encourage you to read it if you're at all into that. This is also based on the idea of reproductive justice, which is a framework that was championed by Sister Song, which is a women of color, sexual and reproductive health collective out of the United States. And reproductive justice is based on 3 pillars. The first is that everyone should have the right to have a child. The second is that everyone should have the right to not have a child and to prevent or end a pregnancy. And the third is that everyone should have the right to parent children in communities that are healthy and safe. And so reproductive justice is an amalgamation of the terms social justice and reproductive rights. And it came after, or within third wave feminism, when that movement was largely directed by white women and their concerns and their needs. And so we saw a lot of conversations focused on access to abortion, access to contraceptives, but the needs of women of color were being ignored in those discourses. And so things like police brutality or environmental justice are concerns for communities of color and are really critical to the idea of being able to raise a child in a community that's healthy and safe. And so I really like the idea of reproductive justice because I think it extends the conversation about sexual health. It extends the conversation about reproductive rights beyond just those really specific tangible things that are, like focused on people's bodies and anatomy, but focuses more on us as a society, us as a collective, and the things that we need to be able to live out our truest, most just lives. And so that's work that I think is really critical and that I return to quite often as well. The next piece is intersectionality, which is a framework for understanding individuals as being impacted by multiple identities, which overlap and compound on one another, which creates varying experiences within the world. And intersectionality theory is an idea that was conceived of by Kimberly Crenshaw in the late 1980s. And there's some overlap with that idea of reproductive justice there as well, which is just that for people who hold multiple identities, like myself, being a woman, being Black, and being queer, that all of those things intersect with one another and create a really unique and also sometimes extremely marginalizing experience in the world. And identity is a key component of what I focused on in the discussion of my research. So we'll come back to that intersectionality idea as well. And then the last piece here is sex positivity, which is an attitude that celebrates sexuality as an enhancing part of life that brings happiness, energy, and celebration. So that means that we are focusing on how to achieve ideal experiences rather than solely working to prevent negative experience. And I think specifically within a frame of sexual violence, this can be really critical. There is still a place for sex positivity, even in some of these conversations, because if we only ever focus on harm, if we only ever focus on risks and consequences, we don't provide young people with the skills that they need to be able to have those happy, healthy, thriving relationships. And so it means that we need to also be able to speak about the positive elements of people and their sexual experiences, while also teaching young people to mitigate some of those risks and consequences. So in my literature review, I focus on a few different topics. Oh, thank you so much, Christina. That is one piece of writing that nearly makes me cry every time I read it. So there are a few different topics that I kind of visited in my literature review. And so I'm just going to give a brief overview of what those things were, because it really shaped the direction that this research took, obviously. The first is sexual health education. So as I've mentioned, I'm a sex ed teacher, so that's kind of my bread and butter. And I understand that not everyone on the call is going to be a sex ed teacher, but there are actually different places in our communities where people are delivering content on sexual health. And I would argue that if you are talking to young people in any way, shape, or form about their sexuality, then you are also a sexual health educator. So this is critical information to have. So the first one is the Saskatchewan health education curricula. Obviously, that's what young people learn when they're in classrooms, and that is where the majority of content on sexuality is housed. The health education curricula in Saskatchewan haven't been updated since 2009. So we're looking at curricula that are more than a decade old. There's no mention of consent in the curricula, so we know that they're out of date and not meeting the needs of students. The second piece is the Unesco technical guidance on sexuality education. That is a massive 600-ish page document that outlines best practice standards internationally for the delivery of comprehensive sexuality education. So when I'm talking about comprehensive sexuality education, I want you to imagine like a little trademark sign beside it, because CSE is a thing. It is a very specific practice that dictates how sexuality education needs to be delivered in order to produce the best possible outcomes. And so it's a standard that we can also try to work towards and to live up to. So not all sex ed is created equal is essentially what is being implied there. But because the technical guidance is such a massive document, it's actually been distilled into a more useful document for us as Canadians, which are produced by CCAN. And those guidelines are called the Canadian Guidelines for Sexual Health Education. So the Canadian Guidelines for Sexual Health Education are really helpful because they help to provide direction in terms of what should be covered when young people are learning about sexuality. But one of the things that I really appreciate about them is that they speak to people outside of the classroom who are also responsible for the delivery of sexuality education, right? So that might mean for kids who are in a care or custody situation, that the staff working with them there are responsible for that delivery. It includes people like elders, it includes like hospital settings, all of those different places where a young person might be learning about their sexual health. And the CCAN guidelines are actually available as a PDF on CCAN's website, so I would recommend checking those out. And then there's also a really fantastic document that goes alongside those called Questions and Answers. And in that resource, they just kind of explore some of the really common questions that people might get about delivering comprehensive sexuality education, like pushback from administration or whatever it might be, and then provides answers and responses to those kinds of situations. So both of those are really handy to kind of have around. So the research on sexual health education shows us that young people who receive CSE are significantly less likely to experience unintentional pregnancies than their counterparts who are participating in abstinence-only education. We also know that teaching young people about contraception is not correlated with any form of increased risk. And there has been a ton of research into abstinence-only programs over the last few decades, and none of that research has ever found those programs to be effective. So students in those programs are not more likely to delay their sexual debut, which is probably one of my favorite terms in all of this practice, sexual debut, the first time they have sex, or to have fewer sexual partners, or to abstain entirely from sexuality. So across the board, we know that comprehensive sexuality education is the best way of achieving the health and social outcomes that we want for young people in the future. I also explored the idea of risk a little bit. And so, like I mentioned, historically, sex ed has been really focused on risks and consequences, and those discourses are really pervasive in sex ed, but they have an impact on young people. But one of the things that adults, professionals often make the mistake of is assuming that risks like sexually transmitted infections and unplanned pregnancies are the only risks that young people deal with in navigating their sexual identities. And in reality, there are a lot of outside influences that are also going to dictate their understanding of what a risk is. So we know that there has been some discourse around femininity that will influence condom use, which is basically the idea that a proper, sensible woman, a delicate flower, if you will, isn't going to ask to use a condom because that's not ladylike. So condom use, or just like realistically, any kind of expertise around sexuality can be seen as like an affront to that idea of femininity. There's also research on relational commitment and condom use. And again, I know that lots of this is focused on condom use, but you can just imagine that we're talking about any kind of interaction, any kind of communication that is happening between two young people negotiating their sexuality. So relational commitment was another one. And this one is really interesting because in this research, they found that young people with high levels of relational commitment, meaning two young people who were really committed to each other and felt safe in the relationship, would say that they didn't ask to use condoms because they trusted the other person. And if they asked to use a condom, that was going to imply that they didn't trust them, and that might create issues in that relationship. But then on the opposite end of the spectrum, for young people who cited that they had low levels of relational commitment in a more casual situation, they would say that they didn't ask to use condoms because they were worried that the other person might reject them if they asked to use them, or might not be interested in having them as a sexual partner. So just showing the ways that relationships themselves influence the ways that young people negotiate. We also know that power is significantly correlated with difficulties in negotiating condom use. And I think that this makes sense, but for a young person, more specifically for young women who are in relationships where they feel that they do not have the same amount of power in the relationship as their partner, they're not going to be able to negotiate condom use. And so these risks are just kind of like one piece of the puzzle. I think I said this at the beginning, but I'll maybe just reiterate. I know that there are lots of reasons why young people don't use condoms, and so much of that comes to these social and emotional barriers and the things that are implied when you ask someone to use a condom. And so whether or not it's that you're implying expertise or you're implying that you don't trust that person, all of those things are really challenging conversations to navigate. And so this is why that idea of risk is so important in having these conversations. The next idea that I explored in the literature review was gender. So I mentioned this at the beginning, but when I set out to do this research, I was really focused on the participants only being girls, people who identified as girls, and I really wanted them to be heterosexual girls. Now that was not even like particularly my own identity. Like I've said, I'm queer, but I also knew that there was something at play in relationships where gender was a really big influencing factor. And so I wanted to unpack that relationship between gender and power a little bit more specifically. And so I was focused on gender and power in that relationship. But as the work went on, I also learned a lot about power and race and power and class and those kinds of things as well. But I started with gender. So we know that patriarchal norms impact constructions of sexuality. And those constructions have been changing over the years. So in the past, we had that like version of idealized femininity that was really like soft and fragile and gentle and that kind of thing. But as the years have gone on, as there has been like more empowerment around female identity, that kind of thing, we've also seen the development of new kinds of identities for young people. And so McRobbie talks about the phallic girl who is supposed to enact her sexuality in a way similar to the ways that we used to expect boys to enact their sexualities, expecting them to be like really self-assured and aggressive and that kind of thing. And that is not necessarily more helpful to girls than any of the previous notions of femininity that we've had before. We also know that girls are denied or provided problematic versions of agency. And so this research is really interesting. And actually, Bei Cheng's research from 2015 is really fantastic on this. Her research is on something called the agency line, and it just dictates the ways that young people are forced into different kinds of agency. And so I'm going to do my best to like represent this research because it's more complex than that. But the agency line goes across two different lines. And so one is someone who wants to be sexual. And then on the other end of that, we have someone who doesn't want to be sexual. And then on one end of the spectrum, we have someone who is choosing to be virginal. And then on the other end of the spectrum, we kind of have someone who is choosing to be promiscuous. And there's all these interactions between those identities that create different kinds of identity that are like more virtuous or less virtuous or whatever it might be. And so those are really, really, really complicated ideas that girls are forced to navigate and to exist in between. And we don't often reflect on how challenging that is because they're forced to make these decisions about the ways that they're going to experience their sexuality, about the ways that they're going to communicate about their sexuality. And there are these very specific narratives that they are allowed to do that in. And stepping outside of acceptable narratives often has really challenging or harmful consequences for them. And then the last piece is something that is really critical to the work as well, which is the fact that sex ed is one of the best ways that we can address gender norms. And so that research from Grosgrave and Kohlfeldt. And one of the things that I really like about that particular piece of research is just that it shows that providing young people with comprehensive sexuality education is one way of addressing gender norms, which by default is one way for us to also address things like gender-based violence. And so if we're talking about reducing sexual violence for future generations, providing young people with sexuality education right now is one of the best ways we can do that. I actually was just in a classroom with grade 8 students like 20 minutes before showing up here, and they were brilliant. And they had so many just like fantastic comments about consent and the ways that they're forced into situations that they don't want to be in because of the pressures of media and that sort of thing. And sex ed is just one place where we're able to have those kinds of conversations. One of the kids actually said to me, so if all of the messaging that we get on social media is harmful to us and all of the things that we see on TV are, you know, challenging and unrealistic, like where do we get to learn about like the right way to have a healthy relationship? And that was such a good question, right? Because if you don't have high quality sex ed happening in your school, you don't have parents who are approachable, then there becomes fewer and fewer avenues for young people to explore some of these ideas. And that in the long run does have really harmful impacts. I also explored the idea of race and class, and spoke a little, I guess, spoke about, learned a little bit about the ways that that influences young people and the experiences that they have. And so one of the things that is really common in terms of race is that there's significant stereotyping that happens for young people depending on their racial identity. And so in Sharon Lamb's work, she identifies these ideals of femininity, and I can't remember what all of them are off the top of my head right now, but they're kind of like based on that idea of like fragility, of passiveness, of femininity, that kind of thing. And those ideals are only presented as ideals for white girls. And kids of color aren't extended those same kind of ideals around sexuality. So they are often hypersexualized, fetishized, exoticized, or in some cases, like for students who are Asian, they're seen as like asexual, or we have this like benign sexuality presented for them. And so there's a lot more to navigate around sexuality when we start to think of the implications of race. And this is where that idea of power comes back into the conversation, because I was really focused at the beginning of my research on the impacts that gender has on power and young people being able to negotiate in a relationship. But I hadn't really considered the ways that, you know, hypersexualization is going to dictate the narratives that are available to you as a young person of color in trying to negotiate some of your sexual relationships, or just, you know, the general experience of having less power in the world because of your relationship with your partner. We think about gender-based violence, sexual violence. We know that marginalized populations are often more at risk for victimization. And that's just demonstrating one of the ways that race is impacting people's experiences there. So one of the things that we know is that providing young people with anti-racist sex ed is one way that we can work to combat some of those stereotypes and to also unpack the those experiences or those influences of race, I suppose. And then the last piece was around gender and sexual diversity. And so initially I wanted, like I said, all the participants to be heterosexual, and I wanted all the participants to be girls. But then I realized that they didn't have to be heterosexual to have interactions with men. And being bisexual myself, I should have like been able to identify that as an issue early on. So I eventually changed the criteria for inclusion to include anyone who has you know, sexual romantic relationships or interests in men as well. And that was a good call, because as it turns out, I think 5 out of 6 of the people that participated in my research all identified as bi or somewhere on the spectrum there. But again, similar to racialization, we know that queer youth are also marginalized in the context of their sexual experiences as well. And actually, if you look at the research, out of any other population, bisexual women have the worst health outcomes related to sexuality. So we know that there are like significant impacts there as well. And when they're in the classroom, queer youth also experience silencing, they experience heterocentricity, they experience pathologizing and tokenism. And so there needs to be a place for them to have these conversations. And I think that that applies to, you know, sexual violence as well. There's a tendency to focus on heterosexual relationships, and sexual violence happens outside of that as well. And so that should be something that we are able to anticipate. And Jose Munoz is a theorist who talked about this idea of disidentification, which is exceptionally complex, and I probably can't summarize it as well as I could when I wrote my thesis, but it's essentially the idea that once you have been marginalized, outside of the norm, then you have to find new ways of relating yourself to other people and to society. And that process of disidentification can be really complex for queer young people in trying to figure out who they are and how they relate to the world around them. So this is a quote from one of the authors whose work I actually enjoyed a lot as well. She said, "The complexity of young people's strategic negotiations requires a change in sexuality education to meet the lived realities and actual challenges facing young people with diverse backgrounds and affiliations to support them in developing sexual agency over themselves. It is crucial, therefore, to view sexual agency in the full multi-systemic context of personal desires, interpersonal dynamics, available narratives, social norms, and social inequities." Which I know is just the most long and complex quote, but I think that she hits on some really important ideas here. And one of them is just that these conversations are complex. And so there's a lot of nuance. We can't, simplify these conversations into neat packages, because human sexuality has to be one of the most, complex parts of our experiences in the world. And then the last idea that I explored in the literature review was, of course, emotional intelligence. And so emotional intelligence is kind of interesting because it's mostly been kind of researched or used from like a business perspective, but there are applications of emotional intelligence in other places. And so I thought that it was, a kind of unique idea to explore. So a lot of the work on emotional intelligence has been done by Daniel Goleman, and he identified 5 key features of EI, being self-awareness, self-regulation, internal motivation, empathy, and social skills. And I'll come back to that towards the end of the presentation. We know that emotions enable or hinder teaching on uncomfortable topics. And so Reagan and Francis did some work specifically on individual teachers and their experiences talking about sexuality education with their students, and how those teachers' approaches to it changed the education that was delivered to the young people. Sybil Young-Moodley-McLeod researched educators as subjects with their own sexual history and intersecting identities. So what do we as individuals bring to these lessons? And Lando King et al. Discussed the potential for social and emotional intelligence to address sexual risk-taking behaviors among adolescents. And so when I was thinking about emotional intelligence, it's true that emotional intelligence is exceptionally beneficial as a skill for young people to have, but I really wanted to focus on the people who are providing this education and the levels of emotional intelligence that they have. So I know, of course, that not everyone, like I said in this conversation, is going to be a teacher, but this is applicable to people who are counselors or therapists or who run support groups, like whatever it might be. The emotional intelligence piece is just going to be really critical in any conversation that we have around sexuality. Okay, so my research was participatory action research, which means that the participants in some ways had the ability to shape the direction of the research. I really like participatory action research because it focuses on collaboration, on capacity building, and on consciousness. And it also promotes authentic engagement, initiative taking, and empowerment. And so the way that the research went down, if you're very curious, is we did a 1.5 hour comprehensive sex ed lesson. So just what I would typically deliver in a classroom. Then we spent 45 minutes doing a collective biography, which is a really cool exercise where you ask them all about their experiences at certain stages in their life. And then they fill in that information. And then we look at it together as a whole picture and not as an individual story, but as a collective. We spent 20 minutes doing a focus group, so just kind of debriefing the lesson that we had. And then they also had the opportunity to participate in a 20 to 30 minute interview if they had other stuff that they wanted to talk about that we didn't get to in the main session. And the results, I just Googled everything. And that's one of the kids saying that's how they found all the information that they needed about sexuality. So we learned that for most young people, they started learning about sexuality and their sexual health between the ages of 11 and 14. They were taught some of those traditional classroom lessons by teachers, puberty around grade 4 and 5, STIs and pregnancy around grade 8, grade 9. And they also were delivered what I love to call the playground education by peers, right? So that's all the stuff that you hear from your friends at recess as you're growing up that is truthfully usually quite seminal for young people in their understandings of sexuality. In informal education settings, they learned about sex from their parents, they learned about it from their friends, from the mainstream media, and also a lot from the internet. And I think it's going to be mentioned later, but I'll say it now just in case it's not. One of my favorite sites for young people to learn information was a bunch of them said that they learned a lot about sexuality from fanfic websites. So like Archive of Our Own and Wattpad, which is where people write fanfic about, I don't know, stories that didn't have sexual content that they wanted to have sexual content, or just like imagined fantasies, that kind of thing. And it was really interesting because a lot of them said that that was probably the most positive representation of sexuality that they were actually exposed to, because the narratives weren't the same as what you might see in mainstream media and movies. In a formal educational setting, they learned about puberty, STIs, pregnancy, abstinence, and a lot of really gender-specific information. A lot of them talked about being separated into a classroom with the boys and the girls, which is not a practice that I would advocate for, because I think there's so much that's important for young people to hear about each other's experiences and understandings of sexuality. And when you separate them, you make some things seem like a girl's issue and some things seem like a boy's issue, when in reality they're often relational concerns. And some of the things that they wish that they had been taught, they wish that they had been taught about consent. That's a theme that came up a lot. For the most part, none of the participants felt like they had adequate education around consent. They wish that they had learned about pleasure. They wish that they had learned about anatomy. They wish that they had learned about queer relationships, about identities outside of, traditional heterosexual relationships. A lot of sex ed can be really heteronormative. They wish that they'd been taught about gender, about the impacts that gender has on decision-making or risk or available choices, narratives, all that kind of thing. And they also wish that they'd been taught about pornography. And so knowing that we're kind of, consistently coming back to this conversation around sexual violence, I think it's important to acknowledge that a lot of the education that young people get about sexuality comes from pornography. Pornography is very readily accessible, and it makes sense that that's a place that they would go for information. But one of the things I always say is that I don't think that pornography is inherently good or bad. I'd say that I am pro-pornography, but pornography is produced in a society that is misogynistic and racist and violent. And so a lot of the themes and a lot of the representation that we end up seeing in pornography can be really harmful. And young people need to be provided with the critical skills to be able to unpack some of those ideas. And so in the focus group, I kind of themed some of the comments and experiences that they were sharing. And I divided it into four subcategories of embodiment, agency, and identity. So when we talked about embodiment, we talked about the ways that young people's identities are completely separated from their bodily experiences, which means that they're not taught anything about pleasure. They're not taught to, love and appreciate the bodies that they've been born into. They're not provided any information on like what sexual experiences actually are supposed to feel like for them. They're not taught that sexual experiences are something that's supposed to be pleasurable. And denying that embodiment then becomes an issue down the road when we're talking about agency and what they're seeking out in a relationship. So one of the participants said, all of it is so critical to me. Pleasure, what an orgasm is, the difference between the vaginal parts. So just even having the words to, speak about your own body. And that's really common. Yesterday I was teaching anatomy to a class of grade 5 students, and we talked about the fact that everybody knows what a penis and testicles look like because people are always drawing them on dirty cars and on the walls in the bathroom. But vaginas in particular remain a mystery, vulvas remain a mystery, and people aren't given that critical language about their own bodies. And it becomes really challenging to advocate for yourself and your needs if you can't even speak about your body. And so not having the words to talk about stuff is an issue that's also tied to power. So that embodiment piece is really critical. The next piece was agency. So one of the quotes from the participants said, "There's so much pressure around young girls and hypersexualization and rape culture and things like that." And so agency in a way is about what narratives are available to us, what choices are available to us, how are we able to actually enact our sexuality. And so when I reflect on this idea of agency, I reflect on my experiences talking with young people, and I often think that what I see is a lot of people doing what they think that they're supposed to be doing instead of people doing what they actually want to do. And that's because they've been handed this narrative about the way that their sexuality is going to happen or what it's supposed to look like. And a narrative is essentially like a script, right? And they just start following the script without thinking about whether or not that's somewhere that they actually want to be, or like how that experience is influencing them. And so agency is really critical in terms of like keeping kids safe and letting them know that they have choices available to them. But things like stereotypes, expectations within a relationship, those reduce the amount of agency that young people have. Gender roles is another big one. Like I mentioned before, those ideas around femininity, being passive, being submissive, those things all deny young people agency that they need. And then the last piece there is power dynamics. And so again, power can be related to gender, it could be related to class, it could be related to ability. Any of those, marginalized or oppressed identities are going to be impacted by their relationship to power. And it's important for young people to be able to recognize those differences in power so that when they are in relationships, they can work to make them more equitable, because we can't change the whole world, but we can certainly change the way that young people relate to one another. Well, we can maybe change the whole world. I don't know how many people are on this call right now. There's 24 of us. I think that's like just enough to start a revolution. The next one is identity. And so, focusing on the way that their identities led to them being excluded from some of these conversations. One of the participants said, if we'd had that in my 5th grade sex ed, that would fix so much stuff for me growing up. And she was talking a little bit more specifically there about, gender and the influence of gender. And gender identity. Also this idea of like the information constantly being heterocentric, which really excludes young people who are queer. Like I said, the majority of my participants ended up being queer. And so they hadn't necessarily had the opportunity to have those conversations about what this might look like outside of a heterosexual context. The next one there is that the information was 2S LGBTQ exclusive. So again, completely excluding those particular identities. And then one of the other ideas that came up was indigeneity. So one of the participants had self-identified as Indigenous and spoke a lot about Indigenous women and their experiences of sexuality. We know that there are high rates of sexual victimization, of interpersonal violence, gender-based violence that impact Indigenous women. And that was not a conversation that she had had when she was in sex ed growing up. And those things do need to be addressed at a systemic level, but also an interpersonal level, if we want to see those outcomes changing and those rates being reduced. Actually, some of the kids that I've been working with over the last semester just put on a moose hide campaign walk, and the Moose Hide campaign is an Indigenous-led campaign that's focused on reducing gender-based and interpersonal violence. And I was just so incredibly proud of them for having put that whole thing together. It was a better protest than I've been to that have been organized by adults. But improving outcomes for all populations, but specifically for Indigenous peoples, also means that we have to be able to address the impacts of identity, the impacts of colonization, and all of that if we're going to change some of these conversations. And then the last theme that kind of came up was experience. And this meant that young people were constantly telling me that they learned about something because they experienced it. And that's the worst possible outcome that I could hope for a young person, is to learn about a bad, hard, scary thing by experiencing it. So one of the participants said, I never learned consent until I myself had to be confronted to that. So they hadn't learned about, consent until they were in a situation where they were being violated or where they were being assaulted. And that wasn't like the only circumstance where they spoke about that. So they were talking about being diagnosed with STIs and just having no knowledge of what that diagnosis meant or what it was going to look like, prior to being in the clinic, having to deal with things like pregnancy scares, and also lots of consent violations. And that was a pretty common theme as well. So moving into the discussion, one of the kids said, I wish that sexual health became a normal conversation. I wish that this was something that we could all talk about. And here we are, we're doing it. So some of the things that girls are actually learning when they're in school, they're seeing these graphic images of STIs over and over again. That's a completely separate lecture from this one, but that's not helpful for anyone and not really necessary when we're learning about something like infections. There is still a really heavy focus on abstinence. And I want to be clear that I have no issue with abstinence. If someone wants to be abstinent and that's the best decision for themselves, and that's fantastic. That's something that we should celebrate. But young people who want to be abstinent still need information around negotiating their needs, communicating with partners. And so comprehensive sexuality education is equally important for a young person who is planning on staying abstinent as it is for a young person who is sexually active. They're learning a lot about gender stereotypes, about who is allowed to be irresponsible, about who's allowed to be passive, about who's allowed to be assertive, about what's acceptable for them as young people. And for the most part, those stereotypes are really harmful. And really another common theme was that the males in their classroom, the boys in their classroom, that their comfort was being prioritized. So a lot of the participants felt that teachers wouldn't engage in challenging conversations because they were worried about the ways that the boys would respond to that information. And so that their comfort was constantly being centered and their needs were constantly being centered. The girls that I worked with were experiencing shame. That was a really constant theme that came up. Shame, more shame. They are dealing with a lack of knowledge. They just have not been provided the information that they needed to make the best possible decisions for themselves. They were being denied embodied experiences of sexuality because their bodies were being so divorced, so separated from their actual thoughts and feelings and all of those things, and they just didn't have the language to talk about their bodies. They didn't have the language to talk about pleasure. They had no way of knowing what pleasurable experiences were meant to feel like. And this is a bit of a segue here, but sometimes sexual health educators talk about something called the pleasure principle, which is different than Freud's pleasure principle, but it's the idea that if we focused on sexual pleasure, that could be the only thing that we talked about with young people, because all of these other conversations would fall into place. And talking about pleasure in a classroom is absolutely the hardest thing to talk about. Like even for me today, that's something that I would really struggle with. And that's because it seems like to be the most taboo piece of the conversation. But like realistically, people have sexual experiences because they are pleasurable. And talking about pleasure is one way of reminding young people that that is something that they deserve in a sexual relationship. And if two young people in a relationship were focused on pleasure, then we wouldn't need to talk to them about consent, because they would be paying attention to the other person's experience. They would be checking in and making sure that the other person was having a good time and that they were enjoying themselves. So the ability to talk about pleasure and the importance of talking about that, I think, is often kind of underestimated, but something that I will continue to emphasize in doing this work. We know that they're being denied agency based on some of those other factors like race, class, gender. They are being put in exceptionally complex social and emotional situations. And I know that just from having been in the classroom over the last 8 years. I'm blown away by some of the questions that kids ask and the situations that they find themselves in. And being able to navigate those conversations with them takes a level of skill, but I think it also takes a level of dedication to some of these values around empowerment and whatever else it might be. They are being constantly bombarded with contradictory messages, you know, those messages of you need to be sexual. It's a new 21st century, everybody's doing it, but at the same time being slut shamed and demeaned if they are sexually active, or, you know, they don't even have to be sexually active if people perceive them to be sexually active. And they're also being dealt a lot of hegemonic information. And so hegemonic information is the dominant narrative, like the story that societally we've all come to accept, and that we are all fed around what relationships are supposed to look like, what power in relationships is supposed to look like. So how are they learning instead? They learn from family. They learn from friends. They learn from the internet. They learn from pornography, and they also learn from practical experience, which, like I mentioned before, is probably one of the less ideal ways to be learning. So what can we do to address this? What needs to happen here? Young people need tools to understand and navigate the world around them. Sex ed needs to be able to address issues like inequality and oppression. Teachers need to be able to understand their own emotions. So I haven't spoken a whole lot about us, about professionals, about the people who support young people, but we, for the most part, were socialized into the same world that they were. And so all of these harmful messages were messages that we were also taught, and we're all going to have, you know, bias around these ideas. We're going to have specific expectations, and we're going to, you know, live within specific narratives and that kind of thing. And we actually need to be able to look inwards and pay attention to our own emotions in order to do this work. Teachers need to be able to understand their own relationship to sexuality. And I haven't gone into this a ton, but like we can also think about things like religion. We can think about things like culture. Those have massive influences on the way that we understand our sexuality and our relationship to it. And so we also need to be able to think about those things, because that's not necessarily going to be the same experience that the young people that we work with have. And we know that teacher training interventions should focus on emotions. So I'm really happy to have this opportunity to talk with you today about this project, because to me, this is doing the work that I set out to do, and being able to share this information and hopefully encourage some of you to, you know, pursue more learning on the topic, or, you know, to give you the strength or the, I don't know, support, whatever it is that you need to be able to have some of these challenging conversations with young people. It's not about doing it perfectly. It's just about starting the conversation. Okay, so this is not the real conclusion of my presentation. This is just the conclusion of the research piece. And then I want to talk more about like what this means for us in practice. So in sex ed, we know that girls are having their identities ignored. They are being denied embodied experiences. They are being denied agency over their decision-making, and they're learning through poorly informed experiences. But as educators, when we use emotional intelligence, it helps us to assess our own emotions. It strengthens our ability to empathize with students. It also supports self-awareness and emotional regulation. And bonus, and I haven't spoken about this yet, but it helps us to model a constructive use of emotional intelligence and communication for students. So just by us doing emotional intelligence, young people will also develop the skills to use emotional intelligence themselves, and that is a protective factor for them going forwards as well. Okay, so now what? That's the end of the research piece. I know that mobilizing emotional intelligence is going to help improve health and social outcomes that are related to sexuality for young people. And it also provides us as adults with a strategy for mitigating challenging emotions and uncomfortable conversations, which creates an atmosphere where we are better able to center the needs of young people and to approach them with the care and the compassion that young people deserve. One of the most important things that I can kind of emphasize in this work is that sexuality is really complicated. There's lots of different tools for kind of talking about this, and I often use a wheel of sexuality from teachingsexualhealth.ca, and I think it's got 12 different spokes of factors that influence our experience of sexuality. And I think that that's why I love studying this so much, and I love talking about it, because it's complex and it brings in so many elements of who we are as individuals, but also of the world that we live in. When we're having conversations about sexuality, they are inherently going to turn into conversations about power. And so that means that we also need to be able to talk about things like sexism, heterosexism, cissexism, ableism, and racism, and classism. So all of the isms with the young people, if we're going to be able to understand their experiences. And I think that kind of calls back to that quote from Sensi at the beginning of the presentation. There are so many influencing factors that are providing young people with these narratives about how they are going to live their lives. And we need to be able to think critically about that stuff and also provide them with critical thinking skills if they are going to make different choices or find new narratives. Emotional intelligence is really beneficial because it is agile to the complex needs of adolescents, and it focuses less on broad expertise. So what I mean by that is, as a sex ed teacher, like I said, I've been asked 5,000 questions about sex. I don't always have the right answer to that question, and that's fine, because it's not about having the right answers all the time. It's not about having statistics memorized or always knowing exactly what the average length of a penis is. It's about being willing to be there and have the conversation. And so I think that this idea of sexuality can be really overwhelming for people, right? Especially because as adults, there's like so much hinging on us being seen as experts, right? Like nobody wants to stand up in front of a group of kids and admit that there are things that they don't know about sexuality, but that's the reality. Most people aren't experts on these specific issues, and that doesn't mean that you can't have the conversation, right? That definitely means that there are opportunities to just explore ideas together, right? And to learn about some of those things that you maybe didn't get the chance to explore when you were younger. And so it really focuses on those personal reactions, on the interactions that you have with young people, and also doing some of the pieces around emotional regulation in challenging situations. And like I said, again, the extra bonus here is that when you model this capacity to young people, they pick up those skills themselves as well. And that is going to be so helpful to them. So I don't think I mentioned this yet, but I actually just finished developing a resource for SAS on mobilizing emotional intelligence for working with adolescents. And so most of this is content that I have pulled out of that resource. And I think everyone who's participating will probably be receiving one of those booklets as well. But this is just like focusing in a little bit more on those five, what were they called? 5 pillars, the 5 pieces of emotional intelligence. So the first one is self-awareness. It's paying attention to the way that you are behaving and the way that that impacts the people around you. In the conversations that I had with my research participants, they were very in tune with the ways that their teachers were responding to these conversations and how they felt in the classroom, how they felt when they were asked a challenging conversation. And that had a really big impact on their learning, but also just on how they were able to identify like what was normal behavior and what wasn't normal behavior, and like whether or not they felt stigmatized by questions that they were asking, that kind of thing. And so I think that that self-awareness piece is really critical. It's just that first check-in of like, how am I being perceived right now? What is my mood? What are my emotions? The self-awareness piece also kind of reflects on how are the people around me influencing how I feel right now. So it's how am I feeling, and it's how are the people around me making me feel. The second piece there is self-regulation. And the self-regulation piece is like, you've got the self-awareness, which is like the check-in. Self-regulation is like now changing your behavior based on what you have learned in that check-in, right? So it's managing your needs and your impulses. It allows us to stay calm in stressful situations and also helps us to respond appropriately. We can essentially like summarize that as thinking before you speak. Now I have a scenario, so I'm not going to like get into this one too much because I think it'll be more beneficial when we get to the scenario. But effective self-regulators are seen as being trustworthy. They are comfortable with ambiguity, comfortable with the nuance, the gray areas, which like anyone who works with kids can tell you that it's all a gray area for the most part. And they're able to create judgment-free spaces. So being an approachable adult means that you're probably excelling at self-regulation. Approachable adult is just one way that I kind of talk about adults that kids trust and that they can come to with tough questions. The next piece there is internal motivation. So that lets you kind of like reflect on some of the rationale behind your thoughts and behind your behaviors. What's motivating you? What lens are you bringing to this? What are you trying to achieve in doing this work? And so this means paying attention to the values that we live out and just some of the biases that we hold, right? I talk a lot about bias in other work that I do. Bias is just something that people have. You cannot not have bias. Bias isn't inherently bad, but it's really important that we're able to be aware of any biases that we do hold, right? And so like just off the top of my head, a really like classic example of that is, you know, hearing that somebody was sexually assaulted and then saying, oh, I wonder what they were wearing, right? Like that's a bias around misogyny and gender that is kind of being enacted into thought there. And so one of the things that I also always say when I talk about bias is that I saw this quote one time and it said, the first thing that you think is what you've been socially conditioned to think. And the second thing that you think is what defines who you are as a person. So we're all going to have those instincts to think things that are racist or sexist or misogynistic, whatever it might be. There's not a ton that you can do about that. But your second thought, the thought of like, why did I just think that? Is that true? What am I going to do with that information? Is the thought that's more important. And then the last two are empathy and social skills. So empathy is our ability to understand the emotional needs of others and to treat them accordingly. We know that adolescence is incredibly challenging for young people. They are dealing with so many tough situations and just like all of that. God, I can't even imagine like right now in the middle of this pandemic and having their lives altered in like such dramatic ways. They have to deal with a lot. And so it's really important that we bring the patience, the kindness, compassion, and care to young people. You know, just try to think about how you would have felt at that age. Like, what were your needs? What did you need to feel supported? And then the last piece here is social skills. So your ability to manage relationships, build rapport, and find common ground. Having strong social skills helps you to be more effective when supporting young people, as it can make you more persuasive, and it also helps to foster change. And I'm going to get into the social skills piece once we do this scenario here. Okay, we're doing pretty good for time. I love it. So these are just some tips that I have for anyone who is working with young people, because there's always room for improvement in these conversations. So the first thing is that we need to like redefine what we consider to be effective. This was an idea that I came back to in my thesis research a number of times, because how we define effective is often like from an adult perspective, right? And so it's like, did they learn about the risks and transmission risks and symptoms of STIs? And that's like what we would conceive of as being effective, when in reality, maybe the young people need to have like a conversation around like your first kiss and what it's going to feel like and how you ask somebody to kiss them. And so we need to also pay attention to like, what do young people themselves want to learn? We need to be able to appreciate their knowledge and their experience, and we need to be able to let them also tell us what they need in the moment and what is going to be effective for them. And of course, like we have research and all that stuff that shows us what kids need to learn via curriculum or whatever else. But I think that especially in these conversations that are so nuanced around sexuality, that we also need to let young people themselves direct these conversations. We can also always do a vibe check. So it's really important that we try to stay open, that we're candid, and that we're comfortable when we're broaching these conversations. And I mean, that can be challenging sometimes. Like if you were raised in a household that was really sex negative and you never learned to talk about these things yourself, then it can be really challenging. One of the things I would say though is that it certainly gets easier the more you practice. So maybe you have some coworkers that you can like run through a conversation with quickly or practice with. But I think that the openness piece is really important. And I always say this, you don't need to have all of the right answers. You just need to be the person that they can come to find the right answer. So that means that you can like say, wow, such a good question. I've never thought about that. Let me look it up. And rely on other professionals who are around to be able to get that work done. And for what it's worth, like that's one of the things that Saskatoon Sexual Health does is we support the delivery of comprehensive sexuality education, but we also support social workers who are dealing with challenging situations with some of their clients. We support, I don't know, I've had daycares call me before to say, like we've got a 4-year-old that won't stop touching themselves at nap time. So if you're ever looking for support on any of these issues, you can definitely get in touch with us as well. And we also want to be prepared. So plan to cover a wide range of topics. Talking about sexuality without talking about things like desire or pleasure denies critical information to students. And remembering the pleasure principle that I was kind of referring to before. Those are really, really important things to talk about, and they often get sidelined, but in so many ways they are more critical than learning how to use a condom. This is from work from Louisa Allen. I really like her work. So if you have at all been interested in anything I'm sharing just about like sexuality education and best practice standards, that kind of thing, I would really recommend her writing. I believe that she's in New Zealand. And so there's just like a lot of parallels between the way that this content is delivered in New Zealand and Canada, similar relationships to Indigenous populations and colonization and that kind of thing. So she explores some of those ideas in her writing. She said, effective sexuality education is conceptualized when educators can be open, candid, and comfortable talking about sexual issues. All right, so here's a scenario that I mentioned. And I included this one in the resource that I prepared as well. It just says, a student approaches you and asks if you can speak privately. They disclose that they may have been sexually assaulted on the weekend. So this just moves through the 5 steps of emotional intelligence here. So the first one, self-awareness, check in with yourself before you respond. So how are you feeling? Are you having a visceral reaction to this information? Because if you were, that would be totally legitimate, right? Do you feel sad for this kid? Are you really angry? Is this like triggering or harmful to you because of past experiences you've had? You need to kind of get on top of those emotions before you prepare to respond to them. The second thing is the self-regulation. So it's important that you're able to respond in a calm manner. A few years ago, I was able to work with SAS and CUSER, which is the Community University Institute for Social Research, on the preliminary study around sexual violence in Saskatchewan. And so we spent a lot of time on the road. Patients and I spent hours and upon hours in a car together. And we interviewed survivors of sexual violence. We interviewed secondary survivors, and we also interviewed people who kind of work in support roles or whatever it might be. And one of the things that stands out to me the most is talking to a secondary survivor about a disclosure that they had had with their child. And they had been really upset when the kid disclosed that they had been, sexually assaulted. And they felt like their response in that moment prevented their child from coming to them in the future with other challenging situations, right? And so if a kid comes to you and shares something that is unsettling or upsetting or whatever it might be, it is natural for us to have those reactions that are really strong, right? And a lot of times those reactions are warranted. But if the kid's worried that they've upset you, they're probably not going to come back to you with this kind of information. So it's really important that we respond calmly. And if you don't have the ability to respond calmly in that moment, that's okay. Like, take a breather, take a second, say, I'm so glad that you came to me with that information. I don't have time to talk about it right now, or I just need a minute. Can we come back to this conversation later? And do that in a moment when you feel more prepared. The third thing, what kind of support is it that the student needs? So what's your motivation here? If we're talking about sexual violence, I know that a lot of people immediately start jumping to the to-do list of things that need to happen, right? Like, do we need to report this to the police? Do we need to talk to your parents about it? Do we need to like track down the assailant? Do we need to start, like the whole reporting process? Do we need a forensic kit? And those are like good things to be aware of. But I think that there's often a tendency to try to like force people into reporting or force people into sharing more information than they're comfortable sharing. And we need to like really think about, how much information do I actually need in this moment? What is important? And do I need all of that info to make sure that this kid is supported right now? The fourth piece, letting them know that they are not alone. So using our empathy skills, it doesn't mean that you have to have had the exact same experience as them in the past, but just acknowledging that you understand that they are going through something that's incredibly challenging, and letting them know that they don't need to do that alone. And then the last piece is social skills. So this is a really good opportunity to use our active listening skills. Are you actually listening, or are you just listening, waiting to respond? We can think about our communication skills, the way that we're talking. And you might also want to think about like the need to ask for clarification. So don't just start like jumping to assumptions about what's happening. If you're not entirely clear on what's being shared, that's an important moment to kind of clarify and to check in to make sure that you're on the same page. So I believe that that is all that I have for you today. I just really want to thank everyone again for taking the time to listen as I've been sharing. It was a really big goal of mine to be able to do some knowledge mobilization around this project. And so I'm very appreciative of that.
Thank you very much, Natalia. So we do have a few questions and things that were kind of dropped into the chat as well. So initially just somebody wanting to express some gratitude and says that they're an older adult and they had just recently heard the term ACE, ACE, and realized after kind of being prompted to do their own research that it's kind of validating how they've always felt about being asexual with little to no sexual attraction towards others, and just sort of not sure about having a question, but just sort of it was incredibly validating that doesn't make them an abnormal person, and just they're so glad that there's these conversations that are occurring with young girls that they can practice their self-care, practice their self-worth sooner rather than later as they're sort of moving through that process of adolescence. And I just want to thank the participant who made that comment, because yeah, I think all of us probably would never return back to that phase of adolescence in our lives if we ever had a choice, because of exactly kind of what we're talking about. It's just a very interesting and dynamic time for everyone. So yeah, I appreciate the work that you're doing, Natalia. And so I do have a question in the sense of, like you spoke about, where can youth, adolescents learn about healthy relationships? And like you said, one of the grade 8s in a presentation that you just delivered was basically saying, if all of this media that we're consuming, be it social media, TV, music videos, is sort of inherently damaging, like where do we find those sort of exemplars for what a healthy, either romantic or friendship style relationships, but then as we sort of have adult youth and progress towards wanting to explore their sexuality and make their sexual debut. Would you have any advice, or even where we as sort of folks who have youth in our lives can kind of like direct them potentially?
When we talked about it in class just now, I said, I hope that you have an adult in your life who's willing to have these conversations, who's prepared to be like a romantic philosopher and get into some of the nitty gritty and just like speak about their own experiences. We talked about, you know, being able to have those conversations in a classroom setting and like asking for that from teachers and that sort of thing. But no, like I didn't have a magic answer for them for where to go. One of them mentioned that they follow someone on YouTube or TikTok or something that they really like the way that they talked about relationships. And so I think one of the things I emphasized more than anything else is that in the absence of like perfect examples of where we can get that information, that we at least develop some of the critical thinking skills to be able to look at the bad examples and at least say, that is not what I want. That's not ideal. We also talked a little bit about like learning from experience. And, you know, I spoke here about how that's not ideal, but certainly if we're just talking about like healthy relationships, people, you know, you have relationships that don't go the way that you want, or that you after the fact kind of reflect on and realize that they were maybe harmful. And that's also one of the ways that we kind of learn moving forwards. I see someone there said Jean Kilbourne is a great resource for the stigma of media on women. Also, I have, maybe I'll just like click to this. I have some resources listed at the end here. And one of them that I recommended is Peggy Orenstein. She's an American author and she has a book called Girls and Sex. And she just kind of like gets into some of the themes that I visited in my research a little bit more in depth in that book. So I would really recommend that one to anybody. I always say, who is a girl, was a girl, has a girl, knows a girl, teaches girls. And there's actually a second book called Boys and Sex that we just finished reading as a staff as well. That's really good. And just kind of gets into like, she interviews young people and asks them about their experiences and some of those narratives that they've been forced into. I think it's just like a really generous offering in terms of like research on this topic.
Oh, for sure. And then I do wonder too, now that we're sort of engaging these conversations with truth and reconciliation and things like that too. So do you see a role, or kind of how can reproductive justice play a role in sexual health, particularly when, you know, we need to confront this reality that marginalized communities, particularly Indigenous communities here on Turtle Island especially, have a history of trauma from residential schools and forced sterilizations, and that kind of, you know, that loss of bodily autonomy, and especially to kind of then have a sexuality be perverted and used as a form of abuse. And so, I mean, do you think that there is a role for reproductive justice and sexual health to kind of work together to kind of mend the harms that we've seen historically?
Yeah, absolutely. And like, maybe I'm biased here, but sexual health is an incredibly powerful social intervention. And, you know, one of the ways that I know that is that when it's time for elections, politicians are always using sex ed and censorship around sexuality education as a dog whistle to like their particular values. And that's because like sex ed is inherently about, you know, power. It's inherently about equity. It's about being in relationship with one another and like what it looks like to be, you know, mindful and fair and kind in those kinds of relationships. And so I think that that's often why people try to stop young people from having sex ed as students, because they know that it's going to result in them, you know, being more open to conversations around identity and more open to talking about healthy relationships and treating each other fairly. And so I absolutely think that for us in Saskatchewan, but like throughout Canada, that having sex ed that is able to address those injustices is really critical. And that's why I've included the piece around racism, but if anyone's interested, Saskatoon Sexual Health has more resources. I'll put the link in the chat here. And so we have one on anti-racist sex ed. And I think that there's also a webinar on our YouTube on anti-racist sex ed as well that talks about how we can talk about those things, because sex ed actually, now that you've got me started here, sex ed itself is racist. Like in the way that it was invented. Like it was essentially just conceived of as a tool to promote the reproduction of desirable populations and to prevent the reproduction of undesirable populations. So just a little bit of a eugenics history there. And that's definitely something that's important to address as well.
Definitely. And I kind of can see connections to everything that we've been talking about earlier today, about this idea too, about that you've said too, of number one, like it's kind of almost starts so small, of like literally just be willing to be there, to like show up for the youths in your life, right? Just be willing to be there, be judgment free. And then, you know, if something that's kind of startling or kind of triggers your emotions, to just like, it's not about you. It's not about anything that, you know, this youth in my life has said. It's just, I need to, you know, wrap myself up in bubble wrap, care for myself here. And then we can return to this conversation in a safe, judgment free and approachable way. But that's, yeah, I think 100% shining a light on sort of, again, how those power imbalances then sort of start to get reflected in the way that we continue to oppress certain segments of our society, predominantly women and girls, and then we add different layers of intersectionality upon that. But essentially, power imbalances exist any way that there's sort of, or violence has the opportunity to exist anywhere there is a power imbalance, and then sort of a secrecy and a shame, or sort of only certain people can have access to this type of knowledge, and will kind of keep ignorance, but then that just continues to allow for abuse, essentially, to continue and move forward.
Well, that's just the most beautiful summary, so I don't have anything else.
Yeah, and I think, I mean, if there's a key takeaway beyond sort of that, just show up for people, and whatever that means or whatever that looks like, and kind of let them lead and sort of set the tone for kind of like exploring what their healthy sexuality, if they have questions or kind of that fear of, is this normal? Is there anything else, you know, not just even our professional lives, but if we, you know, we have youth, teenagers that we're aunties to, or something that you would just say like, hey, this is just like the one thing that you can do just to kind of maybe set the direction in a positive way.
Like, I mean, I truthfully think it's just like being open to the conversation and saying like, thanks for coming to me with this. And that's usually all that they need in reality, is like a sympathetic ear. So
it's powerful and yet so simple. Wow. Well, thank you so much, Natalia. Thank you for being here. I'm going to pass the virtual microphone back to our MC, Harmony.
Awesome. Thank you so much. Thank you, Natalia, for sharing your expertise with us this afternoon. And thank you to each of us for attending our session today. We appreciate your attention to Natalia's work and your commitment to youth in your lives. Your attendance here demonstrates that together we can be champions for the youth and give them the tools they need, as health promotion is an important part of violence prevention. I would also just like to remind everyone that tomorrow, Wednesday the 18th, we have another Sexual Violence Awareness Week educational session entitled Creating Safe Spaces for Indigenous Women, Girls, and Two-Spirit People, panel discussion with the City of Saskatoon. So from 12 to 2 p.m., we will be discussing the city's Coming Home report with the authors, matriarchs, elders, aunties, survivors, and family members of missing and murdered Indigenous women, girls, and Two-Spirit people, as well as Mayor Charlie Clark. To register or learn more, please visit www.svaw2022.ca. We hope to see you all there. Thank you, and have a great rest of your day.